Alright, so people, next topic is Acanthamoeba keratitis. So as you know, Acanthamoeba is a protozoa. So it is a protozoal infection, right? So it exists in the environment in two forms. One is trophozoite form, another is cyst form. So cysts are formed during the conditions that are not favorable for the growth of this Acanthamoeba, while normally it exists as a trophozoite, right? Now few important points that you should know, that the common infection or most common infection which is associated with contact lens users, remember we have done a video on that, है ना? So the most common organism which is associated with contact lens users is Pseudomonas, right? This is number one. Another is the most common infection which is associated with contact lens users who are using, number one, tap water for washing the contact lenses, who has a history of swimming in a pond wearing contact lenses, swimming in pond wearing contact lenses, right? Who are using old lens solutions. So these are 2-3 important points that you should know in regards to Acanthamoeba keratitis, right? Now moving over to the signs and symptoms. These are very important. Please remember, you must be knowing that the disease in which signs are more than symptoms is fungus keratitis, but here you will find symptoms are more than signs. So यहाँ उल्टा हो जाता है, symptoms are more than signs. Now which is the most common symptom associated with keratitis? You know, there will be pain, photophobia, redness. So the patient will be coming to the OPD with complaint of pain. Now you may say, sir, why there will be so much of pain which will be more in proportional to the signs? So there's a reason of so much of pain in Acanthamoeba keratitis. That is, there is radial perineuritis. So what happens is, there is deposition of the infiltrates around the corneal nerves, and these infiltrates lead to apoptosis. Infiltrates, so there are formation of infiltrates which lead to apoptosis of corneal nerves. So that actually induces the pain, right? So first is pain, second is typical appearance that there will be pseudodendrite, right? You know that dendrite is formed in herpes simplex keratitis. Pseudodendrites are formed in herpes zoster ophthalmicus. And of course, if we are talking of dendrites or pseudodendrites, you can stain with fluorescein, है ना? So under cobalt blue light, ठीक है जी? Okay, there is also presence of subepithelial or more commonly stromal infiltrates. Of course, I told you that there will be infiltrates which will be around the nerves. So another important thing that you should remember is, there is presence of subepithelial stromal infiltrates. You know now that the corneal plexus, it lies at subepithelial region and stromal region. So we are talking of infiltrates, but another point I wanted to tell you here is presence of subepithelial with stromal infiltrates. Next is, you find a typical ring ulcer. Ring ulcer is there. So if this is cornea, so there will be So this cornea, there will be a typical appearance of the ring ulcer. Ring ulcer, right? Okay, and this ring ulcer is formed during the late stage. So you know there are two stages. One is early stage, which is less than 3 weeks. Late stage, which is more than 3 weeks. So this is a disease in which earlier you treat, the better is the prognosis. If the patient has come to you in the late stage, the prognosis is poor. Prognosis is poor, right? There is also presence of keratouveitis. So of course keratitis will be there, hai na? And there will also be uveitis. What can be the other things that may happen? One is presence of hypopyon. Then there can be even corneal melt. So these are all the components of the late stages. Corneal melt can be there. 8, there will be association of scleritis. So the eyeball will be very congested and it will be having a lot of pain. One is pain due to involvement of the corneal nerves. Another is pain due to scleritis. You know that the scleritis is associated with pain, while episcleritis, the pain is relatively less, or in some cases it may be painless, है ना? So these are important points. Now how will you manage this case? Next is the management of Acanthamoeba keratitis. Management is first, how will you diagnose? How will you diagnose? So you can go for H&E stain. You can go for calcofluor white stain, calcofluor white stain. You can go for Gimsa stain. Some call it as Gimsa, some call it as Jimsa. It's up to you. Another is you can actually go for culturing the organism. So you can culture it on a special medium, which is non-nutrient agar enriched with E. coli. So please remember, this organism loves E. coli. This organism loves to feast upon E. coli. So you use non-nutrient agar enriched with E. coli. So you can go for culture or you can go for staining, right? So once you have diagnosed the infection, how you are going to treat it? So if we talk about treatment, so the drug which is used is PHMB 0.02%. It is polyhexamethyl biguanide. So this is commonly used. In fact, this is drug of choice, PHMB. Second is you can also give chlorhexidine eye drops. So these are, you are going to give it in the form of eye drops. So PHMB, chlorhexidine, eye drops. So this is the treatment of Acanthamoeba keratitis. So you may get a note on Acanthamoeba keratitis. You may even be asked in your practical viva voce exam. So this is very important.